Hello everyone. I have been recording every surgery for about 7 to 8 years. Maybe not every surgery, but there were a few we didn't record. But except for a couple of cases, there's a video recording for all of the surgeries. You ask this a lot. Why videos? What's the advantage? What does it do? Are you giving it to us? Those are the questions that patients ask. And now I will give you some technical information. I use GoPro 3, a GoPro camera called Hero Black Edition. In addition to our own battery, we have also 5 spare batteries. We have 6 batteries in total. GoPro batteries last for an hour, exactly 1 hour. I don't know how they set it up, but once it is 59 minutes, it shuts down. So if there are 6 batteries fully charged, then we can shoot for 6 hours. That's enough for one day, for me at least. Let me also mention about the settings. I set the resolution to 1080 and the FPS to 50. I set the field of vision width to medium. If you set it to full, it causes fisheye effect. If you set it to medium, you get a flat image. The memory cards used in GoPro are SD cards. I also choose the fast versions of the SD cards compatible with the video. I use 32 gigabytes or 64 gigabytes. In some surgeries, we shoot everything from the beginning to the end. In some, we don't shoot everything, and we don't shoot the parts we see as irrelevant. It changes from surgery to surgery, but in general, let me talk about penis enlargement. We begin recording at the point when we take the fat out of during the surgery. At the end, we turn off the camera and we do the medical dressing. Like as I said, it lasts for an hour. I turn it off right before the battery goes out. This is how I do the shutting down. We begin dressing the wound. I take the camera out. By the way, I make the recordings with a head-mounted camera set. There's a head bandage sold separately. So the camera is on my forehead. I set the angle of the camera. And after that, I start the operation. As I start the camera, I put the barcode in the patient's chart right in front of the camera, so we know we are operating, who we are operating. As we start the operation and I take a look around and how many minutes has passed, I see how many minutes the operation has lasted before it's turned off. The exact minutes are displayed on the screen. I can also see it on the camera. And why? Because our patients are very skeptical. One patient one time asked to see a tape of the operation. I showed it. I brought it into clinic. I showed the video. And the patient says, okay, well, that's really good. This is me. And well, you recorded the surgery. But it's not sure that it's you doing the surgery. I don't see you. So, please don't be that skeptical. Trust your doctor a little bit. Now, to overcome this suspicion, at the end of the operation, I take out the camera, turn it around so that camera is filming myself. Since the camera is standing on my forehead during the operation, only the operating hands and the patients can be seen on the screen. So the patient asks, where's the doctor? Well, the doctor is performing the surgery. The person whose hands you see is the doctor. That's me right there. Still, showing up on the camera at the end of the operation leaves no doubt in the patient's mind. So my advice to young colleagues is to make sure they read the barcode at the beginning of the surgery. Make sure that the barcode remains in the patient's record when the camera is on. And at the end of the surgery, take the camera out and turn it towards yourself to appear in the video and see how many minutes you are in. It is recorded there on the camera. So, why do we record the surgeries on the video? There are many reasons for that. First, for our own development. I add such modifications as my surgical experience develops over the years. I make a change, I change something else, and so on. It is great to watch them later on a video. For instance, we don't do the same surgery today that we did 10 years ago. We are doing it completely differently. I watch the videos from 10 years ago and I look at them. Wow, look at all these things we had done in the past. We are doing them differently now. This is very important for the personal development. Plus, it is very important in terms of gaining experience. For instance, you operated someone 6 years ago. He came back for a follow-up. You cannot remember a surgery. You know, you performed this surgery 6 years ago. You can see the patient's condition, the post-operation image 6 years later, and if you open and watch the surgery video from 6 years ago, everything becomes clearer in your mind. You can directly see the operation being performed, how we did it 6 years ago, and so on. And what are the results? And why is that? This gives you a lot of experience. For example, I have seen this very clearly in penis cases, and I gained a lot of experience in that. This guy came to me in Turkey 6 years ago, and we had the penis enlargement surgery, and 6 years later, he came for a follow-up, and we see the results. How we did this surgery, how we injected the fat. When we open up the video, we see everything very clear. Because we have the recording. I think every surgeon has to do this. You know, this is the way you gain a lot of experience. Sometimes a patient who's had surgery elsewhere comes to you for a revision. For instance, he had a butt implant somewhere else, but the results were bad. The patient comes to you to fix it. You take this patient into the surgery, you remove the implant, and surprise! The implants placed in the butt are both breast implants. Say one is a different brand and the other is a different brand. So these guys have put a breast implant in the butt and called it a butt implant. They're also close in terms of volume, so they use whatever they had in hand. Breast implants and different brands and both sides. If you tell the patient that implants that came out were the breast implants, and that the two sides were different, maybe they won't believe you. But if you have a video recording, there is nothing he can say. The clinic that performed the previous surgery placed a breast implant on his buttocks because it's cheaper. Because breast implants are less costly, but you shouldn't put breast implants in the buttock area because they are less durable compared to butt implants. Butt implants are produced from denser and sturdy silicone as it is to be placed inside the buttock, but there's a possibility of a complication in every patient. There's a possibility of complication for each patient. The simplest thing, the suture could be opened up. You can either watch the video and see how you sutured there. So how did I do it? If I wonder if there is anything missing. In that sense, the GoPro camera is a very useful surveillance camera for the patient's surgery. We need to make the records and archive them. We transfer the images onto the hard drives, external hard drives, and I keep the discs at home. And there's a shoe box in our house. There's no money inside them, only video surgical records. We don't keep these kind of images in the clinic because the computer in the clinic is empty. At night, a thief might come and steal the computer. The computer is empty. We only have the operating system on them. We keep these kind of images, surgical records, on such external hard disks and keep them at home in a shoebox. But our patients have to give their consent. They give us a signed permission to take videos. It is actually more for their benefit than ours. If you have a record of the surgery, if there is a problem in the future, we can go back and look at what we did. Where did we put the stitches in the surgery and how we stitched them? So it is very useful. Thank you very much for watching. I will continue to make these type of videos. If you want to ask anything, please go ahead and send me a message or an email. You'll see the addresses and phones at the end of the video. I will try to help you. Goodbye.